New tonight, opioids are a costly problem that is set to increase.
And according to a study released this month, since 2001, the cost has exceeded $1 trillion in the United States. That dollar amount is from lost productivity, healthcare costs, and additional money going to services like education and the criminal justice system. In Missouri, the Hospital Industry Data Institute found that the bill for opioid abuse in 2016 hit just over $12.5 billion. KCTV5's Ashley Arnold continues to dive into the numbers to see the new ways doctors are trying to solve the problem of overprescribing opioids. New at 10.
For Jamey Brooks, it started simply.
I was probably 25 when I injured my back. I was working in a hospital in the nursing department, and so I was doing a lot of lifting, and it herniated a disc in my lower back.
At the time, the proper pain relief after surgery was opioids.
It progressed to longer lasting opiates, like eventually I got up to literally a fentanyl patch that I wore that delivered fentanyl subdermally into my system.
For nearly 2 decades, Brooks' life was run by his addiction.
There was nothing left. I was on the street, so I was homeless, penniless, living hourly, daily to get what I needed to live when I realized that it just wasn't sustainable anymore. I couldn't sustain it physically, emotionally. It just wasn't possible.
Today, he's able to look back at the lost years with new clarity.
Why didn't you say anything to your doctors?
I didn't want it to stop. Within my head, I felt like I was better than I was before or without the medications.
His story echoes so many others.
I think the very first prescription for me, I knew that it was an issue, and I knew that that I was becoming dependent almost immediately, within the first couple of days.
Doctors say the problem has become more complex. Not only are they trying to help manage pain of their patients, they're finding many people who demand opioids for their pain and varying levels of pain tolerance, which makes it hard to know how much to prescribe.
What is the number of pills that person A would use versus person B? Because there are a lot of differences in their genetic makeup, perhaps their previous pain experiences, perhaps the way they perceive pain, or whether or not that they've even had a previous chronic pain issue that really ramps up their requirement for these kinds of medications.
Khan says those questions are just one part of the issue with opioids. If too much is prescribed,
often they find their way into the hands of people for whom they were not originally prescribed.
Or if enough isn't prescribed.
It may be incredibly frustrating if you are underprescribed medications. Now you're 3 days out, you're still hurting a lot from your knee arthroscopy, perhaps, and you can't get back to your physician's office, or you don't have anyone else to prescribe those medications to.
While a balance can be hard to find, doctors are actively trying to achieve it, whether it's through policy changes on how they give prescriptions, which vary from state to state, to alternative methods for treating the pain, such as what Jamey went through.
And one element of the treatment is methadone.
His solution was a medication-assisted program to help ease out of his addiction.
These medications are medically safe to prescribe. They are given under medical supervision. These medications reduce the cravings and hunger associated with the opiates.
The past 3 years, Jamey has worked hand in hand with physicians like Ahmad Din to get back to a healthier place.
Over the course of 3 years, we have seen improvement in his addiction, that he's not using opiates anymore.
The use of medication paired with other forms of therapy has helped Jamey begin the process of getting back on track.
I've gone through that period, I think, now where physically I'm better. Emotionally, I'm a lot better. And so now I'm able to start rebuilding that life that I worked so hard to destroy.
Across the country, hospitals and pharmacies are working together to come to a consensus when it comes to partial fills of medication to ensure that pills aren't getting into the wrong hands. At the same time, they're working on education for surgeons to make sure that the right amount of medication is given for specific procedures. They also point out that if you do have extra pills that are in your home, to reach out to your local pharmacy to determine how you should get rid of them. In Kansas City, Ashley Arnold, KCTV5.